In this video, we will focus on preterm labor, a significant complication in pregnancy. Understanding its definition, contributing factors, manifestations, diagnostic procedures, nursing actions, treatment, and patient education is critical for ensuring the best outcomes for both mothers and babies. Now let's get started. Preterm labor is defined as the onset of regular uterine contractions leading to cervical changes before 37 weeks of gestation. It is a leading cause of neonatal morbidity and mortality worldwide. Early identification and intervention are key to improving outcomes. Now, let's go over contributing factors, which are factors that may cause preterm labor. There are maternal factors, infections, lifestyle factors, pregnancy-related factors, and unknown causes. Let's first go over maternal factors, which include the following: previous history of preterm labor or delivery, multiple pregnancies like twins or triplets, short interpregnancy intervals, and chronic medical conditions such as hypertension or diabetes. Infections, urinary tract infections or sexually transmitted infections, and chorioamnionitis, which is an infection of the amniotic sac. Lifestyle factors, smoking, substance abuse, or poor nutrition, and high levels of stress or inadequate prenatal care. Pregnancy-related factors, polyhydramnios, placenta previa, or placental abruption. Unknown causes. In many cases, the cause of preterm labor is not identifiable. All right, let's now go over signs and symptoms of preterm labor. The signs and symptoms are the following: regular uterine contractions every 10 minutes or more often, lower back pain or pelvic pressure, vaginal bleeding or spotting, change in vaginal discharge, rupture of membranes, mild abdominal cramping similar to menstrual cramps. Note the importance of early recognition. Early recognition and reporting of these symptoms can lead to timely intervention and potentially prevent preterm birth. Okay, we're now moving on to learn about diagnostic procedures. There are tests to confirm preterm labor, which are physical examination, ultrasounds, fetal monitoring, laboratory tests, and amniotic fluid analysis. Let's briefly talk about each test. Physical examination is an assessment of cervical changes through digital or speculum examination. Ultrasound is to evaluate cervical length and detect signs of preterm labor. Fetal monitoring is used for monitoring fetal heart rate and uterine contractions. Laboratory tests include fetal fibronectin test, which is a biomarker for preterm labor risk. Laboratory tests are also used for screening for infections, such as UTIs and STIs. Lastly, the amniotic fluid analysis, which is used to rule out chorioamnionitis or other complications. Okay, now we are going to go over important nursing actions for preterm labor. Nursing actions are the following: early assessment and monitoring. Regularly assess for signs and symptoms of preterm labor. Monitor uterine activity and fetal well-being. Provide emotional support. Offer reassurance and educate the patient about the plan of care. Initiate preventive measures. Encourage hydration and advise the patient to avoid overexertion. Position the patient in left lateral to improve uteroplacental perfusion. Educate on warning signs. Teach the patient to recognize symptoms of preterm labor and when to seek medical help. Okay, so what kind of treatment will be offered during preterm labor? Let's go over these now. First, there is tocolytic therapy, medications like nifedipine or magnesium sulfate to suppress uterine contractions. Short-term use to delay labor for administration of other treatments. Second, there are corticosteroids, administered, such as betamethasone, to enhance fetal lung maturity if delivery is imminent. Third, there is antibiotic therapy. If an infection is suspected or confirmed, appropriate antibiotics are given. Fourth is the use of cerclage, a surgical procedure to close the cervix in cases of cervical insufficiency. Lastly, there is hydration. Dehydration can exacerbate uterine contractions. Intravenous fluids may be administered. With patient education, the main focus will be lifestyle modifications, symptom awareness, follow-up care, and emergency preparedness. Let's talk more about lifestyle modifications. Stress the importance of avoiding heavy lifting and strenuous activities. Encourage cessation of smoking and avoidance of alcohol or illicit drugs. Symptom awareness. Teach the patient to monitor for symptoms like contractions, back pain, or vaginal discharge. Follow-up care. Emphasize the need for regular prenatal visits. Educate on the importance of completing the prescribed course of medications. Emergency preparedness. It is crucial to teach how to develop a plan for immediate hospital access in case of labor progression. Preterm labor is a serious but manageable condition with early recognition and intervention. As nurses, your role is vital in monitoring, educating, and supporting expectant mothers to ensure the best possible outcomes for them and their babies. Well, that ends this video. If you found this video helpful, don't forget to leave a like, a comment, and subscribe for more nursing reviews.